Welcome to the second hour of Open Your Hearts and Wallets for Blood Cancers. It's a 12-hour fundraiser. I'm Matt Wolf, host of the Wolf Den, and I'll be your live stream host for the next hour. My connection to cancer is that my father had pancreatic cancer and my mom has MDS. This event, it's going to run until 8 p.m. Eastern time tonight. It's part of the Leukemia Lymphoma Society's Man and Women of the Year program. If you'd like to donate, you can do so by going to the link in the ticker below. And in the comments, we appreciate all your donations. Every dollar counts and changes lives. You could also see the rest of the programming that's available at that link. Over the next 11 hours, there'll be live stream shows going on with cancer survivors and supporters, sharing their stories, musicians, entertainers, lots of performances, and much more. As I mentioned, check out the link below. You can donate there, but also they'll be updating the program that's available. Let us know where you're tuning in from. Drop that in the comments, and we'll get ready to go. Tim Sohn decided to be a candidate for Man and Woman of the Year. 15 years ago, he was diagnosed with chronic leukemia. Last June, he started to share his cancer journey with Jenny Gold on her show. Shout out to Jenny Gold, big supporter of Tim and crew. And he's been sharing his story many other places since. Back in December, he found out that he's cancer-free. And then a few months ago, he launched the Showing Up Perspectives on Cancer show with Kara Oelker. Shout out to Kara Oelker. They invite cancer survivors and supporters to share their stories, connect, and to support each other. He's got a fire in him now more than ever to help other cancer survivors and supporters. That's why we're all here today, to show up, to help change lives. Tim's cancer-free now, but that could change in a heartbeat. Many out there are not cancer-free. They're struggling, and everyone has a different story to share. Everyone is impacted differently by cancer, and the good news is that LLS is always working hard to make a difference. Today, I'm lucky to be joined by my mom, Barbara Wolf, and we're going to bring her in to the show. Welcome to the Open Your Hearts and Wallets program. How are you?
Thank you, Matt, for having me.
So tell everybody who you are and how cancer has touched your life.
Well, my name is Barbara Wolf. I am Matt Wolf's mother. Cancer has touched my life, and as my husband had pancreatic cancer, did not survive, passed away about 17 years ago. And about 7 years ago, I developed a cancer called myelodysplasia syndrome, also known as MDS, which from what I understand is a precursor to leukemia. I have been in treatment for 7 years. From what I understand, I have outlived my disease by about 5 years. I intend to live a lot longer. I believe the secret to my success is that I am a holistic person, and along with the medical field of all the chemotherapies, I also take care of my body. I have a very clean diet. I help all the medications along with things like green drinks and all kinds of vitamins. And don't let how I look fool you. I have a very serious disease, and I have a very good outlook. People tell me that they've never seen anybody as positive as me. And I think that, along with everything else I'm doing, is how I stay alive and stay well. I have been in and out of the hospital more times than I care to. 1 year I was in and out every month for 4 months. Looked like I was half dead. I'm very lucky to have survived. I intend to keep surviving. I do a combination of holistic medicine, regular medicine, spiritual. I light candles. I pray. I have people pray for me, and as a result, I'm alive. When even my son, who's very familiar with my disease, tells me I'm very lucky because I survived over 5 years longer than most people survive. So I'm very happy to share, and I hope other people will follow in my footsteps. The doctors thought I was a miracle. And actually, one of them actually started doing green drinks after I told him that's why, it helped the first medicine work so well.
Well,
So,
yeah, you bring up something that I think a lot of people don't know, and this goes with cancer, but it goes with a lot of things. You can't just understand what someone is going through just by looking at them. Cancer, in a lot of ways, is very debilitating physically. That's visual, right? But also, you could be walking around, everyone thinks that it's normal, but you have this cancer that's ravaging your body and you feel terrible. There's things that you can't do, that you have to be cautious about. And, most people look at someone who has cancer, and they don't know, right? Someone like you who walks around and is doing activities doesn't understand exactly what's
yes.
going through their body.
The first 5 years, I had the medicine under control with all of the things that I was doing in addition to it. And I didn't even tell people I was sick because they wouldn't have believed me anyway. But I will say that, having the good attitude, and I learned a long time ago, one of my mother's associates, his wife had cancer, and I remember her saying that on days if she can and she's okay, she's out there. And when she can't be out there and she can't look good, she doesn't go out. And I kind of follow the same thing. If I can make myself look good and do a few things, I'm out there. And if not, I just, I'm home sitting in my chair and spending my time that way. So I think a lot of that has to do with when you feel okay, you need to get out there and you have to live your life. I have
Yeah,
another friend who has many cancers, and she does the same thing. The days she doesn't feel good, she's in bed, and the other days she's out and about, and you'd never know there was anything wrong with her.
yeah. So cancer touched your life, as we always say. It's touched everyone's life. Everyone knows someone who has dealt with cancer, whether it's a family member, a friend. Talk about how early on in your life that cancer touched you.
You're talking about my own cancer?
No,
My husband's cancer.
no, even before that.
There was actually nobody in my family who ever
Not
had
family,
cancer.
friends,
I had
friends.
a lot of friends who had cancer. I lost one friend at the age of 34. Um, she passed away from breast cancer. And I had another friend who, 10 years later, also passed away from breast cancer. Actually, I know quite a few people who have been touched by cancer. I have another friend who's had cancer since I know her for 15 years, and she's still surviving. And I think a lot of it has to do with attitude and your attitude toward life and wanting to live life and not succumbing to the disease. I am not my disease. I am Barbara Wolf, who has a disease, and I don't let that disease run my life.
Think about back to when Penny had you first found out about her. 30 years old. You guys are young, big, great community, and you find out that your friend has cancer. Do you remember what your thoughts were, what the feeling was? Because obviously things have come a long way since then. But what was
I
your
had no idea what cancer was. I had no idea what cancer was capable of doing. I don't think I really understood what was wrong with her, as probably most people don't understand. You'll always have people who will want to know more, and you'll always have people who don't want to know about it. I was probably one of the ones who didn't really want to know about it, and when she passed away, I was devastated, more so than any of her other friends, and I I just, after that, I was just very much aware and knew that there was such a thing. Some people go through life oblivious and they don't understand and they don't, want to understand. I understand a lot about my disease. I am the precursor to leukemia, which at this point I don't want to understand because I don't want to be involved with it. I feel very strongly that when the mind locks into something, the body goes with it. So people who, in fact, the two friends that I lost at a young age always told me that they were going to die young, like their father who had cancer. And I always felt that this was something that, if it was out of their mind, probably would be out of their body. But it's very hard to convince people who don't believe in this kind of thing that your mind controls a lot of what happens to your body.
Yeah. Well, let's talk about the doctors. You've been very fortunate. Your doctor, aside from being a very good doctor, is a very caring doctor. Um, how did you find him, and how has he helped you with this process? Doctors, because you have a doctor's down here, and doctors. Well, down here, you're in Florida right now. You also live half the year in New Jersey, so you're going back and forth. But talk about the doctors.
Yeah, I was very lucky. When I first was diagnosed with something being wrong with my blood, I asked my friend who had a lot of cancers, who she used as an oncologist, hematologist, and she gave me the name of her doctor. And fortunately for me, her doctor couldn't fit me in, so they gave me his associate, and that was the best thing that ever happened to me. This is a man who I didn't find out till 4 months after I was diagnosed that he was not an MDS doctor. He actually was a breast cancer doctor, but he treated me. Anything he didn't understand, he learned. He learned a lot about my disease through me and having to research things. Um, this disease, because of my lack of white blood cells, I kept getting infections in my body, uh, which were serious and put me in the hospital. And the first one that happened almost 7 years ago was it attacked my appendix. And I'm not the type of person who just trusts every doctor. And when I got to the hospital, I gave the doctor on a Saturday night that came in to do the operation a very hard time. And finally, I gave in and said, okay, you could take out my appendix. And they wheeled me into the room at midnight. And who was standing outside the room to assure me that this doctor was okay was my oncologist, Dr. Stephen Weiss, who I wouldn't give up for the world. And he said to me, I knew you were going to give him a hard time. I know who you are. He said, I'm telling you that I would let him operate on my children. You're going to be okay. And with that, they took me into the operating room at midnight on a Saturday night, and I had my appendix taken out. This
Yeah.
man has been through me, with me throughout the last 7 years, the most caring. And I know the first 2 months, 3 months, he used to look at me like, this woman is not going to make it. It's really too bad. She's a very active woman. And I think he was as shocked as every other doctor I've ever seen that the first medicine that I was given worked so much. And he's actually the doctor that started doing green drinks when I told him that I was doing green drinks. I'm
That's
also very fortunate to have a doctor in Manhattan, Dr. Raza, who's a very well known MDS doctor. And I happened to get to her through my son, who was an oncology medical salesperson who had a relationship with her. And after going to the top doctors in Mount Sinai and Sloan Kettering, I finally decided to take his advice and see Dr. Raza, who immediately took a liking to me because I helped myself. And she's been an excellent source of go to for me, as well as for Dr. Weiss, who, when he doesn't understand something or he has to consult, he will consult with her. So it's a combination of me helping myself, medication, my doctors being good, my doctors being willing to communicate with each other. Um, I mean, I attribute all of it to me being alive.
yeah, and it's Doctor Stephen Weiss, University of Miami, Sylvester
Yes,
Cancer Center in Coral Springs,
yes.
and Dr. Raza. If you guys want, if anyone needs information, just reach out. We'll be happy to share it with you. They both are very good at what they do, but they also both have good bedside manner. A lot of people have different opinions on this. My opinion, if I had to choose one, I'd rather have someone who's good. I'm not as concerned about the bedside manner, although I do understand the value of a good bedside manner. Not everyone has both of them. Some have one, some have the other, some actually have none. Well, that's probably a conversation
If
for
I
the
had to
day.
choose, I would choose someone who was knowledgeable, who will help me live. I it's rare that you find a really, really good doctor, and I have been through a lot of doctors. I'm a tough cookie, so to speak, and I'm very hard on doctors. I will interview them before I actually use them, and my life is very important to me. I will also use my brain. I've been in the hospital where I've had doctors tell me I've had heart disease and high blood pressure and AFib, and most of it being caused by the fact that I had very, very low red blood cells, and I knew that. I think you have to be your own advocate to a great extent. You have to be aware, and you have to be willing to open your mouth. I would be on a lot of heart drugs today if I didn't, do that. You have to know your disease, you have to know your body, and you have to be able to communicate.
What you've given a lot of great information and advice for the people who have cancer. As someone who's been around others who had cancer, obviously, my father, your husband, and friends around, what advice do you give people who are new to having someone who has cancer and having them around, and how can they help you?
I think that, the few friends that I have that actually uh, have an interest in, what makes all this happen. And I do have a few that, every time I go somewhere, they want to know what's your blood count? Are you okay? And they ask a lot of questions and they learn about it. I think that's the most helpful thing you could do is to learn a little more about what the disease is so that you can be a little more understanding. And I think understanding is very, very important, especially, for people who are close to you.
What's been the most difficult thing about being a cancer patient? I mean, it would seem obvious, but it's probably a different experience for everyone. For you, what's the most difficult thing about living with this disease?
Not being able to do the things that I like to do. I was a very active person. I still try and do some things. I try and get back into some of the things. I play pickleball every single day for an hour to 2 hours. I did ballroom dancing every single night, 7 days a week. I was an extremely active person. And for me, quality of life is very important. And my Dr. Weiss, who also is very understanding, when he hears I'm sitting in my chair because I don't feel good, he will give me blood, even though other doctors wouldn't, so that I can get out and I can do some of these activities. Because to me, if you can't have quality of life, there's no reason to be here. I've felt this way since I was very young. I'm not one to do, just keep me alive for the sake of keeping me alive. I want to live life. And actually, my other friend who has several cancers is also the same way. While she's alive, she wants to live life. And if she can't live life, she's not that anxious to be alive. So it's a personal thing. Everybody's got their own opinions. My husband actually didn't even feel that way. My husband he just wanted to be alive for the sake of being alive. And so everybody's got different opinions, and you just have to know how you really feel about it, and then you have to be true to your intentions.
Yeah, and I mean, I feel that way too. Quality of life is big. We've had conversation about when my grandma and your mom was alive. Um, the interesting thing about that is we don't like have a. Sometimes you don't know how much longer you're going to have, and sometimes you kind of do. And cancer is weird that way. With Dad, we knew it was over. Once you had the diagnosis, it's over, and within 6 weeks he was gone. Now he had pancreatic. There's circumstances like Patrick Swayze and Alex Trebek where you can prolong it a little bit. With what you have going on, MDS, it's never going to go away, right, at this point. But you don't know that, by science and the medical field, you shouldn't be around today, and we've beaten the odds. So every day is gravy, which is great. But what is there value to kind of knowing that the end is near or not? What do you ever think about that?
Well, I think, I did. I remember asking Dr. Weiss when he first diagnosed me, and he made it sound like I didn't have really long to live. And I asked him, really, I said, how am I going to die? And he told me. He said, you're going to get pneumonia, and the antibiotics are not going to work, and that's how you will die. And I think it was useful for me to know that, just so that to me, it was incentive to live, and to keep myself healthy in whatever way uh, was given to me. I was never an antibiotic person. I'm actually very lucky that my whole life I didn't choose to go on antibiotics, because I'm having enough antibiotics now to last a lifetime.
Yeah.
So, it's very useful to know. I would not normally take antibiotics, except for the fact that he told me that that's what was going to keep me alive. So I think being informed is very, very important, and letting it in, and letting it, and just be part of you.
Yeah, we got a lot of great people in the audience. That Tim is an incredible person who has such a great network of people to support, and mostly because of the stuff that he does to support everyone else. What's it been like is me. Tune in next hour. Tim's a producer. He knows. We tune in next hour to hear what it's been like as me to live, with cancer. I don't have cancer, but with people who have cancer and people who've died. It's yeah, when you do go, for all of us, because it could all be over for me tomorrow. Hopefully not. I live my life that way to be, do the things that make me happy. And if it was the end for me, that I would be comfortable that I did good in the world, and that I lived the life that I wanted to live, and, for the most part, did what I wanted to do and didn't have any regrets and stuff like that. And hopefully this is a long time away from you, but do you think about the things that you would like to accomplish now before your time is up that you haven't been able to do? Or are you just pretty comfortable with what life has been and you're just trying to extend the ride and enjoy it?
Well, about 7 years ago when I first got this disease, the first 4 months were extremely rough. I was in and out of the hospital. My body kept attacking itself with infections. And I was at the point where I was in a lot of pain from one of the infections, 24/7. And I actually had reckoned with myself the fact that I've had a really good life, look back and reflect that I've had a good life, that I've experienced a lot, and it was okay, if I had to go. So my advice would be just to live life to the best that you can. The things that I can do, I do. The things that I cannot do, like right now, I'm not allowed to go on airplanes or any public transportation because of the germs and my lack of white blood cells. So you just have to come to grips with it. My kids taught me a long time ago, and I think that I've gotten to the point where I got it. It is what it is. Deal with it. Do what you need to do, and deal with it. It's just what it is, and I think it helps me in every part of my life. Like yesterday, I had a tooth taken out because my teeth are very weak from this disease, and it was my front tooth, which I hope nobody can see this morning.
Can't.
But
Your lighting is worse than my lighting, which is not good to begin with, but that's okay.
Okay, so, but I basically, when anything happens, it is what it is. Deal with it. And I think that that's the best advice that I can give anybody. Deal with it, and deal with it positively, and deal with it to make the best outcome that you can. People who want to give up on life usually don't make it through life.
Yeah, and that's great advice. I also want to say on the other side, it's okay to be sad about your situation. It's okay to have a bad
I
day.
very rarely feel sorry for myself. I just sometimes am not happy that I can't do certain things, like get on a plane and go visit my friends in
Yeah,
California and Arizona. But I always have the hope that someday the white blood cells will come back and I can get on the plane. Nothing is forever and nothing's written in stone.
what has been, if we look on the bright side of getting cancer, what would you say has been a positive in the last 7 years?
I think the positive, and I felt that way with my husband who had other diseases before he got pancreatic cancer. I think once you've got a disease identified, that you now know you have to be going to take care of it, and nothing is going to be a surprise because you're always in contact with doctors. There are a lot of people who don't like to go to doctors. I'm not a big doctor fan myself. And once you're aware, you know that you could be taken care of. I knew once my husband was seeing somebody for his heart that I wouldn't have to worry about him dying suddenly from a heart attack because he was being looked at and monitored and taken care of.
Yeah, it's look, we're fighting it. That's the number one thing. Whatever it is, we got to fight. Dick Vitale. I know you don't know who Dick Vitale is, but he's a very famous college basketball analyst. Had cancer. He's 80 years old. He beat it. Rang the bell last week, and man, he shared his journey on Instagram. He was in the hospital and sharing it. And I think sometimes we need to see the bad side of this, right? Because you don't see it in a lot of people. Same with I'm a big advocate for mental health. You don't see that someone has these mental health issues. You might not see someone who has a blood cancer, or I mean, there's other cancers too if there's no physical evidence of it. But you know, to see that people are struggling, and sometimes that inspires you to live your life a little bit differently if you're sick or if you're not sick, and sometimes that inspires you to want to help. And we need help as much as we can get with the blood cancers, with every cancer. That's why we're doing this, and Tim has done this to generate money. So donate if you can, but also to inform people. The information that you've shared today is going to be very helpful for people who are listening. Maybe it's they need a new doctor. Maybe it's
Yes,
they should.
absolutely.
Yeah,
I believe if you're not happy and you think something is wrong, your brain is very good. Go with your thoughts. If you think that you are not being treated properly, go find someone else. Doctors are not gods. And my mother always said to me, and it's something I live my life by: God helps those who help themselves. And if you are out there and helping yourselves and looking at it and not depending on everybody else to help you, that's really part of what keeps me still alive.
yeah. She also used to say, "We make plans and God laughs
And
too."
God laughs. Right. Right.
All right. Well, appreciate you coming on here. As I said, it's going to be helpful to people. We can get information about doctors, and if you have any questions, reach out, and we'll be happy to answer any questions or help however we can. So
The
thanks.
other thing I would like to say is we all have an inner voice. You have to listen to it and you have to act on it, because that inner voice is telling you something that you need to do or you need to know. And it took me many, many years before I actually listened to that inner voice.
Yeah, we procrastinate a lot about a lot of things, and your health is not one to do. So get checked out. You know.
Yes, it doesn't. All the money in the world
Yeah.
does not give you health.
All right. Well, we're going to let you go, and we're going to bring on our next guest. But
Thank you for having me.
of
I'm
course,
very happy to share.
thanks a lot. All right. Okay, we are. Well, we'll do a. If you're tuning in now, you've joined the 12-hour live stream of Open Your Hearts and Wallets for Blood Cancers. We're celebrating Tim Sohn, a candidate for Man and Woman of the Year, supporting the Leukemia and Lymphoma Society. You can donate by going to this link here. If you can't donate, share the information, whatever you can do. Share the links. At this link also will tell you the other program that's going on. I'm going to be on with the next hour to talk about, continue the conversation. And then there's like 10 more hours. It's a long day, but it's a great day of helping and information. And so welcome to the show here. For those who don't know who you are, give a quick introduction and then we'll get into everything.
Yeah. Hey, my name is Alex Rosa, and I'm a registered nurse from Ohio. I'm not currently in Ohio, but I am from Ohio. And I teach all about holistic health and wellness. So I was totally vibing with what Mama Barbara was talking about. Oh my goodness, I loved everything she said. So yeah, I'm so into holistic health and wellness, and I teach clients and I teach students. So I'm a nursing teacher as well. So all my students get the whole holistic thing when they're going through their program and how to treat patients. And Barbara's story was just a perfect example of how to the patient's perspective and how you take care of a patient and what they're going through and how you need to interact with them and get to know your patient so that way you can take care of them the way they need to be taken care of, and be treating the whole patient, not just the disease, not just giving the meds. It's taking care of the person. And so much that she talked about, oh my goodness, was
And
fantastic.
you're a registered nurse. What is your connection to cancer?
So my connection to cancer is one that I'm a nurse. So I've been in healthcare for over 18 years now. And so I've had plenty of cancer patients, all different types of cancer that I've taken care of. I've worked in all different kinds of settings, inpatient, outpatient, not so acute. And then most of my career was in intensive care. So taking care of really sick patients. And then my personal connection is that my uncle was diagnosed with leukemia and passed away very quickly. And this was about, I think, 14 years ago, because my daughter had just turned like 1 when this happened. And no, sorry, my oldest son. So he's 17 now. So this was about 16 years ago. He passed away from leukemia, and he had got the diagnosis, and then literally like a week went by and he passed away and he was gone. And it happened very quickly. Went on home hospice, and as soon as he got home, he literally passed away as soon as he had got home. So I have that. And then also my mother is a breast cancer survivor, and she was diagnosed very young with breast cancer. And she was able to have it treated. And so now she's been in remission, no cancer, anything has come back. And then I, in turn, had to have an exam, and I had to get surgery because I had found a lump. So I have been lucky to not have to require any other, treatment with that. But mostly with my uncle was probably the most impactful, and really emotional, because I was so young then as well. And then having younger children and having to go through this. And it's so different to be a provider and be a healthcare professional taking care of patients. And then it's so different when it's a family member who is ill like that, because all of your knowledge like goes out of your brain when it's a family member. And so it's so different. And that's really, was such a learning time for me as a healthcare professional, was when all of that was happening in my life. So.
Yeah. So a little bit to go back to what my mom was talking about with fighting, right? Having positive, wanting to be alive. And you talk about it was your great uncle.
My uncle, yeah,
Your
my
uncle.
mom's
And
brother.
so my grandmother, which was my mom's mom, was in a hospital, and she was in trouble. Wasn't cancer or anything, but they took her to hospice, and literally, like the second she got there, it was over. And I think it's you hear these stories about someone dying and then their loved one dying very close to it. Like they, when you don't want to be around, it's kind of okay. A lot of times that's it. And you see that in, you probably see that. You've seen it with your uncle, but also see that as a nurse.
Yeah, we definitely see that. And what your mom was talking about, that mind body connection. I mean, if you lose the will to live, you're not going to be around. And that happens with patients when they get a certain disease diagnosis, and it's like boom, it hits them and things just start to go downhill. And then also, if it is like your mom was talking about with your dad and with him passing away, a lot of times people do pass away from broken heart syndrome, from takotsubo. It's broken heart syndrome. People pass away from that. It is a very real thing, and I have seen that so many times throughout my career. And that is a real legit thing that does happen to people. So that everything she was talking about, that connection, that and the quality of life, oh my goodness, I'm telling you, so many bombs she dropped when she was talking. The quality of life and how you were talking about, like, that is it. And your mom has achieved such a great balance of being active and resting and knowing herself, and what she was talking about, knowing her body. And that's another great thing to think of. If it's you that has cancer, or if it is a family member or a friend, think about, if they're not going out with you or they're not spending time with you, don't be upset about that. Let them rest. They do need to have that balance of activity and rest. But just being observant, if it's prolonged periods of where they're like wanting to stay inside and not wanting to go out and be active with other people, then that could be a signal that something else is going on. But definitely knowing yourself, knowing your body, and balancing that rest and activity, that will increase your quality of life so much. And your mom's doing an amazing job at it. Oh my goodness.
Yeah, there's a balance, right? But I mentioned this. I don't argue with my body anymore.
Yeah.
I took a nap at 2 p.m. yesterday. I was exhausted. I lied on the couch and I'm like, I gotta take a nap.
Yep.
And so we should really be in tune with our body and not necessarily push ourselves. But on the flip side, sometimes you do have to push yourself, because you can't be lying in a chair. You have to get up and walk. You see that when people are rehabbing. You see that when they're in the hospital. Say, all right, just walk around here for a little bit. So push yourself enough. But then, we're not professional athletes that have to play a game to get a paycheck. So really, relax, do what your body allows you to do, and really get in tune with your body, which is what she said. Like, if you have a gut feeling that something's wrong, get it checked out. I mean, I'm as guilty as any. I sit with my mouth, for like years. I didn't get something done, and then usually it's, you're right about it, and it's something bad that's going to happen. Waiting is not going to make anything go away.
Right. Yeah, exactly. And staying, and your mom had talked about having a good relationship with your doctor, with your medical team, and that's so true. Having one person that you trust, that has that good bedside manner, that knows how to talk to you in the right way. And your mom was so spot on when she said that, she could take that tough news. Like, she wanted them to be real with her and tell her what the outcome could possibly be. And the thing is, not all patients are like that. Not all patients are like that. But the key is, if you're the provider, to know that about your patient, to talk to your patient, to talk to the family, to get a feel for how you need to approach the situation, to relay that information in a way that is going to make sense to them and that is going to help them, not make them feel bad or make them feel worse about the situation. So in your mom's case, she wanted him to be real with her and tell her what was up and what the possibilities were. And that drove her to making other decisions and really helped her in her journey and how she wanted to heal and go through this process. So that's the other thing, is have a great team. Have somebody that you're seeing routinely, getting those routine tests done, getting those physicals done. Don't wait till things start to pile on and pile on and pile on, because at some point you get to the point of no return, right? And there's not much that you're going to be able to do to come back from something that you're going to be diagnosed with. But if you stay on top of things, and the testing now is so great, we're so advanced now, we can detect so many things early on. And preventative medicine is something that we as a society, as a culture, do not invest enough in, is that preventative medicine. So I'm a huge advocate for preventive medicine, taking care of yourself, being your best advocate, like Mama Barbara said. Be your best advocate. Eat good, take care of yourself, take care of your mind, take care of your body. I mean, she's spot on.
Yeah, she's been very fortunate with the doctors that she had, as good the doctors for her cancer. Even she talked about getting a tooth pulled. Her dentist, who I went to, my sister goes to. It's been 40 years, just getting lucky. Some people don't get lucky with doctors, and it's tough to see, because there are people, and with no fault to their own or no blame. You're a nurse. You see how busy people are, right? And overworked, understaffed. Now you got COVID. You throw COVID in the mix. It's hard to give every patient the amount of attention that they want. Forget about that they need. Sometimes it's hard to give what they need, but also what they want. And my mom wants a lot, which she should. The same with all, you should want as much as you can get, and you should fight. And she's a big thing. Fight and advocate and fight, and don't take no or I'm too busy for an answer. She's lucky to have the personnel around that. So what do you see in the hospitals with the people who are dealing with this? And how do they deal with short-staffed and not enough time to talk with their doctor?
Yeah, so there's two things that you have to think about, and I always tell when I'm teaching my students is like, you've got like two patients. Technically, when you have one patient or one room assigned, you technically have two things happening. You've got the patient and you've got their family. And that's who you end up taking care of. And you have to, obviously your patient is the first priority, and then the family comes afterwards. But in many times, in my case in ICU, like if the patient is really, really sick, it's the family that you're really communicating with and having that relationship with. So as the professional, you have to get very practiced in how you negotiate this and how you navigate this situation. But, you have to get to know your patient, and that's the biggest thing. And I would encourage people who are patients in the hospital, you described the setting perfectly. And I don't think it's any secret now that we know that staffing is short. We don't have enough bodies. We don't have enough people to do the things that we need to do. And, COVID's not 100% gone yet. It's still around. We've still got flu. I was just at the hospital the other week, and we had a bunch of isolation rooms, and actually the majority of them were flu and just a couple COVID. So flu is still around, and we've always treated flu with that isolation and wearing masks and all of that, because it's a respiratory virus. It's very contagious. So we still got issues with staffing no matter what. And so knowing as a professional, and when I teach my students this, I tell them, get to know your patient, talk to them. Like, that should be your first priority, is talk to them, get a feel for them, get a feel for how much interaction do they want with you. And as the patient, talk to your nurse, talk to your staff, don't be afraid to have a conversation with them and to let them know what you expect. What do you want from your stay there at the hospital? If you're able to communicate that, let them know, because we do have patients who don't want anybody really bothering them. They just want you to go in there, do what you got to do, and leave them alone, and they're perfectly fine with it. And then we've got other patients who they want you in there updating them all the time on what's going on. They want you there every 2 hours for those pain medications, like they are on top of it. And I am a big advocate for empowering your patient and for letting them know, like, these are your expected times of your medications, and these are your expected times of treatments and tests and all of that. Like, I like to let the patient know what's going to happen today, what's their schedule, what's happening, so that they can feel more in control. Because that's the other part of it, is when you're in the hospital, you got this new diagnosis of cancer, or maybe you've known you got cancer and it's just something's flared up, there's another problem. The lack of control, the lack of feeling of being powerless can be so debilitating and can mess with your mind so much and with your emotions so much. So I like to try to give as much power and control as I can to my patients. And that's how I teach my students as well, to how to empower their patients. So that's the other huge part. And you can also flow that over to the family members and keeping them updated and letting them know. Don't have the family calling you in a panic. That's like the worst thing. Keep your families updated and let them know what is happening. Be proactive. That's my huge thing that I teach about. Be proactive. Stay on top of that.
Yeah, and that's the other thing you mentioned that brings me, it kind of segues to what I wanted to talk about is, and I saw this a lot. I was with my grandma in the hospital a lot, for a lot of she was in and out, a lot of different things. and I visited her every day,
Yeah.
but I see so many patients with no one to come visit them, and that could range from, someone who's in there for cancer, and it's, they're in bad shape, and what what can be done for those people who don't have the support, and which could really be, mentally,
Mhm.
it's harmful to them.
Yeah, it's definitely mentally very difficult for them. And one of the things that we look out for, especially in ICU, is the ICU delirium, which can affect young or old, doesn't matter. I think a lot of people think it just affects older patients, but it can affect us, even younger. Like, people can be affected by that. It's because you're in a tiny room with like one window or no windows sometimes, and you're in a bed, not able to move, not with anything going on, no sense of time, no sense of routine, rhythm, nothing. And so that delirium sets in really quickly. So trying to maintain a sense of routine, a sense of rhythm for your patients is huge. And spending time with them and just going in and talking with them and learning more about them. I think everything I teach and talk about kind of goes back to knowing the person, because they're not just a patient, they're not just a disease, they are a person with a story, with a family, with a background, with a history. And so getting to know them can really help guide that treatment. And like your mom said, like, her doctor would order blood for her when nobody else would, because he knew her. He knew that girl wanted to go play some games and go do some things, so he wanted to hook her up. If a doctor wouldn't know that, they wouldn't know that that was important to her. And that's the most important thing. What's important to your patient? And you will only know that by talking to them, by getting to know them. So if you're fortunate enough to be able to communicate with your patient, I mean, I know every situation is a little bit different, but we can do different things to communicate with our patients. And that's another thing for another show. But for right now, just talk to your patient. And if you're the patient, try to develop that relationship with your nurse and with your caregiver, so that way they know what your wishes and your wants are, so that way that can guide your treatment so much better. And yeah, we do have a lot of patients that don't have anybody at the bedside with them during really critical times, and that's where you step in. You're a human, you've got human emotions, you make that human connection with them.
Yeah, and we encourage everyone to donate if they can. Again, here's the link for donations. At the link, you'll also see the schedule and where you can find me next with D. Scott Smith, and then all the shows afterwards. There's plenty of information there. If you can't donate, share it. Tell someone to join the live stream. Lots of great information and resources and entertainment going to happen in the next 10 or 11 hours. For the people who can donate, maybe someone who doesn't have any one particular reason to have an attachment to blood cancers, as a nurse, what would you recommend that they do if they want to help and get more involved?
I think just following, because I think you're affected and you're touched by cancer, I think, in more ways than you realize. And just like you were saying, people don't look sick on the outside, but you don't know what's going on the inside. And there's some people that will share their story and talk about things, just like Tim did on Jenny's show, and talked about his things going on. So people are different in how they want to share what's going on with them. But and I don't know, I just keep going back to the thing, like, just talking to people and getting to know them and what's really happening in their lives. And you don't always have to support people monetarily, right? It can be as simple as going over and helping out with something that they need done around the house, or taking them something, or taking their kids somewhere if they're a parent and they've got kids, helping out with that. There's all kinds of little ways that you can impact somebody's life if they have something like this going on. And I think being more aware of the different types of cancers that are out there is another thing. And we've got information at our fingertips now, so you can learn more about this. You can follow any of these people that are going to be on this marathon today, and learn more about them and who they're connected with. There's so many great ways to do that, and just to volunteer is another great way. When I talk about in the things that I teach about, and when I do my coaching and stuff, I talk about volunteering and getting out there more to meet people and to share your story and learn about other people's as well. So that's another great way to do it as well. And like, we're online, and you can connect with so many people online. It's
So easy.
incredible. Yeah.
Tim's got some great advice here.
Mm-hmm. Yeah.
Oh man, I don't too many links here. I don't know. I don't know
Yeah.
what that link is for Dorothy, but if you're on LinkedIn, click it, and I'm sure it's some good information. So yeah, Tim is just sharing a little bit about
Yeah,
the
he's talking about the
therapies.
different therapies.
Different
Yeah, and that's the
therapies.
thing. Like they're coming out with so many great treatments all the time, all the time. And yeah, it's just about finding some place that you vibe with and that you are vibing with their mission and what they're about and supporting them, because it is every little bit helps with that. So,
Dorothy said it's to donate. Yeah, we got this. Seems a little bit, but anyway, anywhere on Tim or Tim's
yeah.
page, you can find out how to donate. The I've had a number of charities and disease organizations on the Wolf Den to talk before.
Mhm.
Donation is a huge part of it, and there's a lot of money thrown at this at disease. Some that can't. It's not about eradicating it because some of these will probably never be gone in our lifetime, but it's about slowing it down, improving the quality of life.
Right.
That's extremely important to have.
Hmm.
Like we all talk about, I wish I had one more day with
Hmm.
whoever.
Yep.
And when you look at someone like my mom, who's got 5 years more than she probably should have,
Yep.
like everything counts. So if we can extend the day, a week, a month, a year, whatever it is, that's huge.
Yeah.
Um,
Yep.
and
Yeah.
I
And
think
that's
that
like, oh, go ahead. Go ahead.
I was just saying, I think that conversations like this can help also by information. We talk about sharing a story. I shared my story with mental health. My mom shares her story about blood cancers. Tim, man, his whole crew, Nancy and Brian and Tim and all of them share their stories. It does a few things. The first thing is once you shared your story, it becomes a lot easier to reshare it and talk
Yeah.
about it again. It really, I mean, and not mine is mild. You know, if anyone knows Nancy, we give her a shout out to Nancy Barrows. Her story is it's it's an incredible story. She was on the Wolf Den. You can watch her episode. You can follow her podcast. But that's a tough. Mine it was tough. Everything in the story is tough to share for some reason. That's a story that's tough to hear. Forget
Hmm.
about tough to share. And then, but we're as unique as we all are. We're not. There's someone out there who's dealing with exactly the same thing that you're dealing with and can empathize with you and will resonate with it. And when I shared my story and you share stuff with my mom and someone's going to reach out to, I didn't know that. I didn't know you were going through that.
Yeah.
Or, hey, I'm going through the same exact thing. Thanks for sharing. That's
Hmm.
one of the most powerful things of these conversations that we have.
Yeah, and I think too, just exactly what you're saying. And there's so many people going through what you're going through, and you think you're so alone and you're so isolated, and that isolation is so damaging, that isolation. So don't isolate yourself. Reach out. There are people that can understand what you are going through and help you to understand what you're going through as well. And oh my gosh, what was I going to say? Oh shoot, you just said something and it made me think of something else. Crap, what was I going to say? Um, no,
Sharing the
it's like
story or
sharing your
people
story.
reaching out.
Crap, people reaching out. Shoot, I can't remember
That's
now.
right.
It
It
was
comes
good,
back
and now
to
I
you.
can't remember. But it was good. No, but yeah, you're spot on. And there's people out there, yeah, that share your story, get to know people, yeah, and people will reach out to you, and it helps other people feel like they are not alone, because they're not, and we're all going through things, and we don't always talk about it, but you find that person that you feel comfortable with and that you can share your story with, and it's so powerful and it's so healing to do that. So healing.
And it's hard to MDS and blood cancers and leukemia. I always I hate to compare diseases because it's just everything is,
Hmm.
it could be paralyzing in its own right and it's devastating to people. But when you look at other cancers and diseases,
Hmm.
I think sometimes they get a lot more attention and a lot
Yeah.
more eyes and all of this because it's debilitating, like ALS, and these people can't move, and pancreatic, you're gone pretty quickly. Metastatic breast cancer. We had a friend of the program, Tammy Bowling, who does a lot of good for metastatic breast cancer. When people think, well, okay, it's never, you can't get rid of it, but man, she's 5 to 6 years past when she should. And the more attention we get, we need to be able to get all of this. All of it. We got to get attention to it. We got to get the conversation. We got to get people more educated. We got to get money to it.
Yeah. And I remembered what I was going to say, because you were talking about when people can't see on the outside what you're going through on the inside. And I think some of it goes to like shame, and people like ashamed to say that something is wrong with them or that they don't feel well. And it's to get over that. Like people don't feel that way with other diseases and with things that are going on, like you were talking about. They get more attention and all of that. And I think people might feel that, well, I've got this blood cancer. It's not as big of a deal as if somebody else with breast cancer or something like that. So I'm not going to tell anybody about it or whatever, or feel ashamed of it. And it's not. Share your story, because other people are feeling just like that. They feel like nobody's going to care because they can't physically on the outside see what they're going through or believe them, right? I don't know. You're lying. You're making that up. No. And I've seen a lot of people that go through that mental struggle as well.
Yeah, man, if there's so much, there's so much help that is needed, and so much help that people can do. We got Mark says Nancy and Brian will be on at 3. So I heard we'll be tuning in. They great people with some great. They're very entertaining. Yeah. Do you know Brian and Nancy?
Yeah. Yep.
Yeah. The shout out Saturday. I randomly came across shout out Saturday, and I'm like, these people are nuts. I want to talk to them.
Yeah.
And, that's what happened. And then Mark will be on at 4. And I'm on in a few minutes here. If you go to the link, you'll find me with D. Scott Smith to talk more about my connection with cancer, which, they're all helpful. It's, we want to hear from the people who have it. We want to hear from people like you who are around it and helping to treat it. People like me who are, have a father, a mother, a brother, uncle, children who have this.
Yeah.
It's just keeping, and I talk about mental health. I champion for mental health with an organization called Same Here. It's just about keeping the conversation moving forward, because there's so many other things to talk about. We talk about equality, and man, there's all the social justice and the news stories. They capture everything, but this stuff goes on, right? Johnny Depp these people are getting coverage, right? They get coverage on a television. Johnny Depp and Amber Heard fighting each other, and then a really famous person gets a disease, and now we focus on everything's like what's the hot topic of today. Yeah. But this should be a hot topic all day, every day, because it's never going away. It's affecting millions and millions of people.
Yeah. And the one thing I wanted to say that your mom said was so important is combining that medication part, right? Because we do need medications to treat things, but that's not the end all be all. And the other things that your mom was talking about the eating well and the diet and the activities and the quality of life and the mental health, that whole mind body part, that's so powerful. And that's the one thing that I try to really teach my patients in the limited amount of time that I have with them, unfortunately, is combining that East and West together, is combining that Western medicine and the medication that we're giving you with other things that you can do naturally on your own to support yourself. When you can combine those two, you can optimize any therapy to the next level and really take control of your health in that way. So when your mom was talking about that, I was like, yes, girl, that is exactly what you need to be doing. And that's what it is. She said, just don't take the medication blindly. Take your medication, know what it is. Many of them cause really bad side effects, and it's how do we minimize those side effects? What else can we do on the natural end of that to increase your quality of life, make you feel better while you're going through this therapy?
Yeah, well, thanks for your time. I got to hop and get to D. Scott Smith. Donate at the link. Find out more information about where I'm going to be next. where the rest of the programming, Mark and Brian and Nancy and Tim, so many great people. Thanks for your time.
Bye,
And
guys.
I'll see you on the other show, which I'm going to right now.